Among the many interstitial lung diseases, idiopathic pulmonary fibrosis or IPF is the most common. In this condition, the lungs gradually become scarred and stiff, making it harder and harder to breathe. Sadly, after diagnosis, the average survival time is only about 3 years. In Europe, IPF affects anywhere from 1 to 23 people per 100,000. Most often it strikes men over the age of 60 who have a history of smoking. Doctors usually recognize IPF by spotting a pattern called usual interstitial pneumonia or UIP on high-resolution CT scans or lung biopsies. Scientists have discovered that genetics plays a role in at least 30% of cases. Mutations in telomere-related genes are key contributors. For example, TERT and TERK mutations are found in 8 to 15% of familial IPF cases and 1 to 3% of sporadic cases. Other genes tied to telomere function such as NAF1, PARN, ARTEL1, DKC1 and TNF2 also raise the risk of developing the disease. Compared to sporadic cases, familial IPF tends to appear earlier in life and progresses more aggressively. Imaging and tissue samples often show more severe changes. Interestingly, patients from these families may also develop other forms of interstitial lung disease, including nonspecific interstitial pneumonia, cryptogenic organizing pneumonia, respiratory bronchiolitis-associated interstitial lung disease, unclassifiable ILD, and combined pulmonary fibrosis and emphysema. Even in patients without detectable telomere mutations, their telomere length is often abnormally short, below the 10th percentile for their age group. Studies show that having shorter telomeres predicts worse outcomes, faster decline in lung function, higher mortality, and poorer survival after lung transplantation. In other words, telomere length is not just a clue to genetic mutations, it has become a powerful marker of disease severity and prognosis in IPF and related lung disorders.